When conduction through the electrical system of the heart is impaired, this can result in various different types of heart block. In normal hearts, the electrical signalling begins from the sinoatrial node located in the right atrium. From here, the impulse spreads through the atria, reaching over to the left atrium via Bachmann's bundle, causing the atria to contract. It then reaches the atrioventricular node, or the AV node, where the impulse is held momentarily. From here, it travels down to the bundle of His, which then divides into the left and right bundle branches, followed by the Purkinje fibers on both sides, ultimately causing contraction of the ventricles. Remember that the left bundle divides into the anterior, posterior, and in some instances the septal fascicles, whereas the right bundle does not have other fascicles. Depending on where the impulse is delayed, different forms of heart block are seen. First degree AV block is a delay in conduction through the AV node and is defined when the PR interval, meaning from the beginning of the P wave to the start of the QRS complexes, is longer than 200 milliseconds. First degree AV block can be commonly caused by increased vagal tone in younger patients or athletes especially, and fibrosis in more elderly patients. Other causes include AV node blocking agents like beta blockers, calcium channel blockers, or digoxin, and it may also be a normal variant. In some instances, it can be the result of coronary artery disease, mitral valve surgery, or electrolyte imbalances like hypokalemia and hypomagnesemia. Usually, first degree AV block is asymptomatic and does not need treatment, but can occasionally progress to higher grade AV blocks, and patients with a first degree AV block have 3 times the risk of developing atrial fibrillation, which is why follow-up is recommended in these patients. In some patients that are symptomatic with PR intervals above 300 milliseconds, pacemakers can be considered.